Good evening. It is my great pleasure to welcome you all to this Q&A webinar to discuss the impacts of COVID-19 on BAME communities in Hertfordshire. My name is Finn Tobin. I'm the Communications Manager for 3 Fox, the marketing agency for local authorities. I'm going to be facilitating the session today for Hertfordshire County Council, making sure that everything runs smoothly and that as many of your questions get asked as possible. I'll be handing over to today's chair, Councillor Linda Hazy, in a moment. But I just want to quickly run through some housekeeping first. So in terms of running order, Councillor Hazy will give her welcomes and a short address, and we will then listen to a short presentation from Professor Jim McManus. Our other panellists will then introduce themselves and explain their roles and why they are here today. We will then move into the Q&A section of this event. Many of you have already sent in questions, but we will be accepting questions from the live audience too. So please do send them in using the Q&A function on your screens. It might be the case that we don't have time to get through all of the questions today, but that's okay. If that is the case, we're going to compile these questions and the panelists will be invited to give answers post-session. And we will distribute those answers to all of the registrants via email. We do have deaf colleagues in the audience today, and as I'm sure you've all noticed, we have an interpreter on the panel. So I do want to advise you to pin her using the 3 little dots in the corner of the picture if you do need her assistance. If you have trouble in doing so, just make it known in the chat, and one of my 3 Fox colleagues will be able to assist. So without further ado, I'm going to hand over now to Councillor Hazy.
Thank you very much and good evening, everyone. I would very much like to welcome Her Majesty's Lord Lieutenant of Hertfordshire, Mr. Robert Voss, CBE, Commander of St John's. Sir, you are very welcome here and we're very grateful for the time that you are giving us. I'd also like to welcome all our other guests who are watching in and of course our panellists. And I am, as Finn has said, I'm leader of East Herts District Council, but I'm here tonight in my role of the chair of the Community Reassurance Cell. Now this is part of the county's COVID-19 recovery arrangements. And several months ago, we undertook a survey to get a better understanding of the impact COVID-19 is having on our communities and businesses in Hertfordshire. We contacted several hundred community and other groups across the county and asked them to fill out a survey with 7 key areas. We asked them about their humanitarian issues, health, economic issues for businesses, resourcing, the public sector, infrastructure and environmental. And we asked them to give us an indication as to how immediate some of those issues were. And I now seriously believe that we will all still be in a similar situation 18 months from now. And we need to make sure that our communities have the reassurance that we can help them to stay safe. So we gathered all this information. We had over 120 replies and they excuse me, and these were prioritised replies into key themes, including developing a BAME action plan, feedback suggesting that the pandemic may have had more impact upon our BAME communities than had been believed right at the beginning of COVID. This programme of work and action plan will start the process to rebuild trust, fairness, and reduce fear of using health and public services in the aftermath of COVID-19. Now, the 4 strands which have come out of this are prevent and protect, communications and behavioural science, high risk reduction, and co-create medium and long-term action plans. And this webinar is the first of a series that has come out of these discussions of our engagement with our communities. We are very keen that some of the inequalities that continue to exist in our communities across Hertfordshire are recognised, and we do our best to make sure that those inequalities are reduced. So in June this year, all district councillors and leaders set out a joint statement on tackling racism in Hertfordshire. The killing of George Floyd in Minnesota has reminded us once again that we cannot and should not tolerate racism in any form or from any person, and that Hertfordshire stands united against any form of discrimination, racism and injustice. However, we know that there are still many injustices to overcome, and as leaders in our communities, we have an important role to play in challenging these inequalities. The BAME network is a key strand of that, and we know that we need better partnership arrangements with our BAME communities so that we can deliver better services and work together to ensure that your communities are not disproportionately affected. Now in Hertfordshire, the BAME communities make up some 19% of the total county's population, which has increased by approximately 8% since the last census of 2001. We have a very diverse ethnic minority community, which speaks over 120 languages as a first language. And Jim will come on later to talk about how we have addressed communicating with those where English is not their first language. So our planned next steps. The County Council will shortly be releasing a survey and will be holding a number of workshops to help co-develop a new county-wide diversity and inclusion strategy. The Equalities and Diversity team at County Council will be sending you information of this when it goes live. The CRC has commissioned a number of awareness-raising videos, including in different languages, and we hope to work with you all in both developing and promoting these. The network and Jim will talk about the areas that BAME Network will focus on over the next few months, and importantly, how you all can get involved. Depending upon demand, we will look forward to hosting a number of other webinars in areas identified through the survey. And tonight's event, hopefully, is just the beginning of all that work. Thank you, Finn. If I can pass back to you, please.
So Jim, I'm going to ask Jim to speak next. So Jim has a short presentation.
Thank you. Good evening, everybody. I'm going to try and share my screen with the slides on it, and I'm very happy to share these slides. So firstly, a thanks to our Lord Lieutenant and Councillor Hazy for joining us. So we are in a second peak of the virus because we're seeing numbers ramp up significantly all the way across the country, right across England. Hertfordshire, we were quite low for some time, and you can see here, this is just an example in dark green of where Hertfordshire is. One district, which is fairly typical because you need to look below the districts. But if you looked at England, the position in England would be much higher currently. And so we have to prepare for a second wave nationally as well as locally. That's the first thing to say. Within that, what we have learned from the first peak of this pandemic so far is that Black, Asian and minority ethnic groups are at markedly higher risk of developing COVID and dying from COVID. Now, those causes we do not think are biological. So it's not that you are more likely biologically to be disposed. Actually, there are a number of causes. And they start with overrepresentation of BAME populations in lower socioeconomic groups, multifamily and multi-generational households, disproportionate employment in lower band key worker roles, and existing diseases like diabetes and so on. And two very important things, the proportion of BAME people on the front line in our health service, for example, is much higher than the proportion in other areas. So we have a situation where, for example, pharmacists are much more likely to be Black and therefore much more likely to be in the front line. So there is clear evidence that COVID does not affect all population groups equally. And there are many analyses that have shown that older age and ethnicity and gender and geographical area are all related to disproportionate exposure. And if we move to the next slide. But what we know is that analysis showed that even after accounting for the effects of sex, age, deprivation and region, people of Bangladeshi origin and ethnicity had around twice the risk of death as people of white ethnicity, and people of Chinese, Indian, Pakistani, other Asian, Caribbean and other black ethnicity were up to 50% higher risk of death compared to white British. It's not that, also we should say, it's not that the hospital care was any worse. It's that actually you were more likely to be exposed, and when you were more likely to be exposed with vulnerabilities, you're more likely to become ill, more likely to go into hospital, and with the treatment we had in earlier in the year, more likely to end up more seriously ill. You can see here, this is a graph from Public Health England, that if you look at black and black British and Asian British and mixed multiple ethnic groups, that is borne out in the graph that both men and women had higher risk than the white group, and men had higher risk than women overall. This, again, is a Public Health England infographic. And again, it shows the same picture, that there is a clear higher risk of survival, of death in Bangladeshi and Pakistani populations in particular, but again, overall higher than white populations. And that's it, just presented. I've presented this 3 different ways because some people can use graphics and some people prefer text. You can see that the risk of dying compared to the white British group, any way you cut it, is higher for people from BAME populations. A slide, and Brian Gunston has just asked who are the others group. The others group were people that the national category system, Brian, couldn't record or didn't record properly in terms of NHS ethnicity. The Public Health England first report, which was based on analysis of data, came up with a series of recommendations, which I won't go through in detail, but they are important recommendations, and I commend you to read the PHE report and these recommendations. And they include better data collection and recording in NHS and social care of ethnicity, something as a country we still haven't sorted out. Community participatory research, which is where we sit down and work out together the kind of research we need to work out what we need to do to address not only the direct exposure, but the root causes of inequalities. And that's something I would like to explore and do for Hertfordshire. I think this is probably the most important slide of the whole presentation, because actually what it shows you is that there are 5 sets of issues that came up from a stakeholder engagement session. So after Public Health England did this very detailed data analysis, they then went round and spoke to several hundred stakeholders. And what BAME stakeholders told them was that the impact of long-standing social and economic inequalities, plus the increased risk of exposure to COVID from that, because staff are in frontline roles, they use public transport more, they're in multiple occupancy houses, and so on. The increased risk of complications and death because they may have multiple long-term conditions or mental health issues or other health issues. The impact of discrimination, stigma, and fear were all factors in this that need to be addressed and need to be teased apart very carefully. So it is not a biological predisposition. So anyone who would blame BAME people for being biologically more susceptible would be completely wrong. These were factors that were about institutions and structures in society. And in moving forward, we need a cross-government and a cross-agency approach. We need to use community assets and understand the role of faith and so on. And indeed, as you can see from Rush now, Hertfordshire Asian Women's Association was involved in part of this very important consultation. I will try and make up a little bit of time to keep us on time. Councillor Hazy has told us that we have a BAME action plan in Hertfordshire and that there are 4 pillars. We need to do more on that. So this is a start, not an end point. But one of the things we've done is work to create videos by community leaders in community languages. One of the things I would like to do is create a workforce of COVID champions and volunteers across BAME communities who can actually start work on messages and protecting our communities. Even things like taking action with workforces at key risk. So things like ensuring that private hire cabs and taxi drivers are trained in infection control and then funded to have perspex screens put up to protect them from infection is important. Now, I can claim no credit for this action plan because I had a small part in it. Our equalities team, our HR team and many other agencies have worked together on this, including many of the people on this webinar, but we have much more to do. And of course, I'm focusing on Black, Asian and minority ethnic because there are other issues about Polish and Eastern European residents and workers that need their own examination from this. So our current health protection in Hertfordshire, despite the fact our numbers are growing and growing fast, is that we keep the county as safe as possible and open for business as much as possible, because the economic harm from the wrong strategy is something we want to avoid as well. We suppress the virus. We work on multiple settings, and I won't go into that, but there's a whole different presentation I could bore you senseless with on the details of the local outbreak plan. We engage and persuade where we can, and we enforce if we have to, and indeed we have enforced illegal events. And the strategy will work provided that the English and neighbouring area transmissions is not uncontrollable. That's where we are currently. A question was asked about why taxi drivers and not NHS workers. Every NHS employer has an action plan to risk assess and protect NHS staff and BAME NHS staff. That was a requirement by the NHS, and indeed the public sector agencies in Hertfordshire all have as well. That has been a requirement and a commitment. So I'm singling out taxi drivers as an example of a category of people who are placed at risk by doing their job, just as an illustration, not as the only thing we're doing. I want to suggest to you that this was a slide I drew in April, and I've made very few changes. In fact, I haven't made any changes to this version at all. I suggested we'd have a second peak around about now, and lo and behold, here we are. That gives me no pleasure. We are still some way from immunity and from a vaccine, and I think full recovery will be next year. We are in phase 1, which is the first 2 peaks. The next thing we need to do is move to control and then to exit from the virus and recovery. Ensuring for the long term we have a strategy on BAME populations and inequalities and their health must be part of that. And that will take every agency to work together on it. I won't say more on that now, but this is the start of the action, and we need to use those 7 PHE recommendations. I'm going to finish there. There are some supplementary slides in case there are questions, but I'm going to finish there for sake of time because I was asked to try and stick to about 10 minutes. There could be more peaks, Sabina. I think we are definitely having a second. I don't know if we will get a second one or not. But for the minute, the key things we have to do is you have to treat every single person you meet as if they are potentially infected by this virus. Why am I saying that? Because actually in the age of HIV, that really worked. And we also knew it worked with TB. And we also know it works in other things. So you wash your hands, you keep your physical distance, you wear face coverings wherever possible and required, and you isolate and get tested if you have symptoms. And yes, Iqbal, I'd be delighted for you to have copies of this presentation. Treat everybody as if they're infected in every situation, because We don't have a vaccine. Immunity is some way off. And the only tools we have to combat this virus are these 4 things, and we know they work. So I'll stop there if I may, given the time, and obviously happy to answer questions when that comes. And Finn, if I may, I'll hand back to you.
Yep, thank you very much. I'm sure I speak for everyone when I say some of those graphs are quite startling, really, aren't they? When you sort of look at that, I don't know, I suppose how disproportionate it is between different ethnic groups. It's, yeah, startling is the only word I can think of, really. But thank you very much for that, Jim. I do see, I think there's a few questions coming in, so that's great. We are going to be moving into that section of the session quite shortly, but I suppose first, before we do, I would just like to go through our remaining panelists and sort of have people introduce themselves and sort of explain what organisation they are here representing. So I might ask Kate to speak first.
Thank you, Finn. Gosh, Jim, that was quite stunning and impressive. Hello, everyone. I'm chair of Hearts Equality Council and also chair of Stevenage World Forum for Ethnic Communities. And I do manage to have a day job, and I'm the CEO of Community Development Action for Hertfordshire. So within all those 3 roles, my own networks is quite strong. With Hearts Equality Council, the trustees, when we're all volunteers, are from the protected groups and have vast experience and access to the different communities, of which I am truly grateful for. We were asked is how and what have we been doing as community leaders? Well, capacity remains an issue, reaching out to communities. We're all in the main voluntary-led. And many years ago, we used to have at least one BAME infrastructure group in each district. However, 10 years on, there's only 3, Hearts Equality Council being one of them. The other 2 are North Hearts Minority Ethnic Forum and in Stevenage World Forum. So huge demands on us, as I said, with very little capacity, but we are doing the very best. We do need our communities to come and reach out to us. We do need them all to approach all their old local leaders to help us understand what is happening, how are they doing, so that some of us in our leadership roles can communicate that back to the public sector. So I have a lot more to say, but I won't. Time is running on. So over to the next speaker. Thank you.
Thank you very much. Reynolds, I might ask you to introduce yourself next.
My name's Reynolds Rosenberg, and I'm the chair of the Hertfordshire Interfaith Forum. That's a group that tries to bring together all of the interfaith groups across the county in order just to talk to each other, learn from each other, but most important, have a connection, a single connection to the county, where most of the important messages on COVID are coming. So we see ourselves as a channel to do that, and the more interfaith groups we can get hold of and include, that means more faith groups that we can contact across the county. That's basically our role, and my job here is to reflect faith as seen by the BAME community, and also as the virus has affected us. And I'm sure there'll be some questions later on, and I'll go into more detail.
Brilliant, thank you very much. So next I'll get Enoch to introduce himself.
Thank you. Good evening, everyone. I'm privileged and humbled to be here in this panel. I'm the chairman for the One Vision project running in Watford for the last 2 years. Before the COVID-19, I wear another hat, Community Chaplaincy Service Department in Seventh-day Adventist Church in Stanborough Park, Garston. The project itself is an action group. We provide to the members to network, exchange ideas, share information and skills, support each other, and provide a voice for the disadvantaged. And also we provide resources and skills, provide training, empower communities. So after this COVID-19 break, we kept one vision, the vision going, and also we responded to the COVID-19, looking at the difficulties what our communities are facing. So all our 51 charities and small groups comes together. We started to deliver and help and support our most need in our community. So currently we are delivering about 4,000 hot meals across Watford and 800 food parcels across Watford per week. And also we started to have very close interfaith dialogues and bringing community cohesion to work, understand what's going on in our community, especially in our BAME networking group. We created recently and we launched One Vision Watford Youth Council. So we're bringing all the young people together to engage during this difficult time. And also we're building a platform for mental health and well-being. One of our well-being champion, Councillor Ravi Martins from Watford, is leading the mental health and well-being. We continue to provide the food program. And I am quite happy to be here networking with my colleagues to answer any questions, what the difficulties are. Thank you.
Brilliant, thank you so much. Clive, I might ask you to speak next.
Thank you, Finn, and good afternoon, everyone. My name is Clive Saunders. I'm the chair of the Watford African Caribbean Association. We're a small charity that was established in 1976 with a focus on the well-being, particularly of the African and Caribbean communities in Watford and the surrounding areas. We've never been exclusive, though, and we've always welcomed participation from all. As Kate, I think, has alluded to, we're in a similar position to most charities. We're now entirely dependent on volunteers for our work. It's interesting, though, around COVID-19, because it certainly is something that none of us have ever encountered before. And for the first time in many, many years, we couldn't engage in our face-to-face activities, both with young and older people. So, like many others, we watch development very closely, but we realize very much, particularly looking at the deaths around staff in public-facing services and its impact on our communities, that it really was causing havoc. Personally, my own neighbor, who was a BAME person, died of the disease. I think we felt that we had to adapt very quickly to the situation and to the technologies in order to engage with our members. So one of the first things we did was to set up a community WhatsApp group to keep in touch. We also engaged in the Public Health England review by submitting our thoughts about what was going on through Professor McManus. And we also engaged with the councils to look to see what they were doing, particularly with the resources that they had for our communities. The situation we are that's occurred is one that we now recognize does need us to look to how we work together to seek these challenges. And when I say work together, we're also talking about working with stakeholders across the piece, because ultimately we think that overall together we're all going to be stronger, and we certainly welcome this development and being a part of a network to take these issues forward. Thank you.
Yeah, and thank you so much. And I think that's a really important thread, isn't it? That, you know, we all have our own communities, but it's sort of when we kind of come together, like that's when we're at our strongest. So thank you very much, Clive. Harjit, would you like to speak next?
Good evening, everyone. My name is Harjit Singh. I work for Hertfordshire Fire Rescue Service as a Quality Inclusion Officer. I've got experiences from the public sector, but also from a community volunteer perspective as well. I'm also the chair of Watford Interfaith Association. I'm also the chair of the Eastern Region for AFSA, Asian Fire Service Association. Just like Enoch as well as a colleague, I'm the vice chair for One Vision as well. But I also sit on quite a few national bodies as well. So for the Sikh Council, I sit on the EC as well. But from a different perspective as well, I'm also a family person that lives in Hertfordshire, in Watford, and got 3 children, and so understand the dynamics of what's been happening. And also with One Vision, we've, as Enoch mentioned about setting up the youth council, I actually try and oversee that side of it as well. So this year was supposed to be quite a big year for myself. Like many others, most probably looking forward to 2020. I had to celebrate, we're going to celebrate 25 years of marriage. My daughter was going to turn 18. The older one's just turned 21 as well. So like many families, we had big events and big things to look forward to. But again, a lot of things have been put on hold. So hopefully we can sort of have that human face that we can talk about today, because I think that's an important aspect, and we can, with some of the questions, we can bring that out as well. Thank you very much.
I mean, well, thank you all for speaking there and introducing yourselves. I mean, it's sort of, I don't know, it's amazing really to sort of see the kind of like different types of people and sort of different experience that we have, you know, in Hertfordshire. So I think with that now, we can go into our sort of main part of the event today. So we're going to go into the Q&A. Just the way that I'm going to run this, I'm going to start with some of the questions that have been sent in already, and then we're going to move towards answering some of the live questions as well. So do please keep them coming. Reynold, I know, has to pop out slightly early today, so I might actually start with a question for Reynold. So Reynold, as many people have strong connections with their faith and places of worship, what do you think the role of these places should be in supporting people at this time?
This has been a lousy time, I have to say, for this disease to come. For the Jewish people, for the last 2 weeks and the next week, the major festivals have been just so totally changed in nature. And I look across all religions, and everybody has suffered and found themselves in an area where they'd never been before. The basic line here is, yes, you can still use the church, the synagogue, the temple, but you have to implement all of the protocols that Jim was talking about, very basic things. You must wear a mask, you must wash your hands, you must have social distancing and safe isolation, maybe additional PPE, gloves, whatever. And all of the places of worship have gone along these lines, even for major festivals. But for the Jewish population, once a week, the Sabbath is something that most people would recognize. So their population goes once a week, and it's all manageable. It's all possible. The synagogue is laid out totally differently. The service is shortened, and lots of the things that would require close proximity are cut out of the service or totally changed. And that's across the board. Muslims need 4 people to have a proper service, and that's not been possible. It is possible now. But for others, it's been easier. Quakers obviously don't worry about that. They have also social distancing, and they haven't got any particular worries to do it. But it boils down to saying, you're not going to see the service that you thought you were used to. It's going to be totally different. Some rituals will be cut out, and you will have to wear a mask and keep social distancing. And my experience is that's actually been implemented. Now, churches and synagogues and temples do more than just sit there and wait for people to come and pray. they are a social area as well. And after a small hesitation, most, if not all, of the places of worship have adopted electronic means to keep socially in contact with their congregations. They will use Zoom for evening talks. They will use telephones. They will actually have the priest, the rabbi, whatever, go by and, keeping social distance, make contact with the people that are in danger, the most dangerous ones, the isolated ones. So we do see across the board in faiths a responsibility in maintaining contact, keeping people safe, and trying our best to try and keep to the worshipping services that we're used to.
Thank you very much. Yeah, it's amazing to hear how these places are like adapting, I suppose. And I know that they've done it so quickly as well, that there was a, you know, I know with the Catholic Church, certainly it was a very quick move to having services and stuff online. So yeah, it's sort of heartening to see that that's happening across the board. So the next question we're moving on to now, it's sort of a big one. So I might ask Jim to speak on this one first, but Linda, Kate, you might want to come in on it as well. So what is being done now to help address the health inequalities that exist in Hertfordshire that COVID-19 has exposed? And what is being planned across the local health system for the long term, so the health inequalities that existed before COVID-19 don't persist in future generations? So Jim, I might ask you to speak on that first.
An easy question then. So I guess the first thing to say is that there's a mechanistic bit to this, which is that the Health and Wellbeing Board has agreed to rewrite its health and wellbeing strategy. And in order to inform that, I want to commission working with communities, working with BAME communities, research on the health experiences of BAME communities and the health needs of BAME communities to inform that. So that's one chunk. The chunk is there is some immediate stuff about ensuring that the NHS addresses the disparities in outcomes with BAME communities. So if you have a population with high levels of diabetes, are we making sure that they get their 8 key checks, for example? So that's another piece of work. We've got some work to do with mental health. So there are actions for people across the whole system. And I think within the next 6 months, we need to set that out, particularly for BAME populations. Then there's a whole issue of BAME employees. And we know that your work is an important predisposer of your health. So all public sector workplaces are committed to doing work on that. I won't go into great detail on that, but I think we do need a Hertfordshire BAME strategy and action plan that addresses all of these things. Because if you look at all the health inequalities data in Hertfordshire, there's no single BAME report. There's about 98 different reports spread all over everything. And I would say this, wouldn't I, as someone who is a person of faith, but the importance of both faith and of community action to people. One of the reasons why we have higher levels of some ethnicities and of some faiths in the healthcare and social care than the general population is because many people were brought up to see it as part of their faith. So the significant Filipino population of nurses that we have, who are all like me, Catholics, but actually Muslims going into, and Jewish people, just to pick 2 examples, and Sikhs going into this because of service. So I think we need to sit down and do a proper multifaceted action plan. The starting point of that will be research and the strategy, but there are actions for everybody. And I'm sorry if that's a slightly long-winded answer, but this is a marathon, not a sprint. So this is going to take us years, but we have to start tomorrow to get action.
You say long-winded, Jim. It sounded comprehensive to me. So maybe another word for it. Linda, Kate, did you have any comments on that?
Yes.
If I can,
Sorry,
Go on,
Linda.
Kate, after you.
Okay, thank you, Linda. Thank you, Jim, and really pleased to hear that the strategy is going to be revamped, etc. But this is a plea from all of us in the community. Can we be invited to the table from hour one? If you include all of us, you know, we're all in this. We are driven and determined to share the problem, but come to a solution together. Because without us at the table, when public sector colleagues and the NHS in this new structure of the integrated care service, if we're not at the table, how do we know it's doing what it's supposed to be doing? And we all, and this is right across the work that I do, we're consultation out. So can we just get it right from day one, minute? This is, sorry to bore you, Jim and Linda, they know where I'm coming from, but it's so important now. Time is of the essence. Our people are so affected by this disease through fear, through confusion, through whatever is being said nationally. The media certainly doesn't help. So can we do this for Hertfordshire, but from day one? Over to you, Linda.
I was just going to pick up on one of the points that's come through on the questions and the chat in terms of isolation and loneliness. And that was certainly one of the topics that came out from the analysis. And I think what we need to do is make sure that we also harness all those volunteers that came forward in the first few weeks of COVID, and did a remarkable job across our communities and our towns and our villages, and make sure that they know that we appreciate them. They know that they are doing a fantastic job. As Jim has said, it's going to be a long haul, and we have to make sure that we don't all get worn out, because I think that is happening across many areas, and many of our volunteers are very, very weary.
Yeah, thank you. I think, yeah, to sort of pick up on that, I mean, you know, a lot of the questions that we did get in, you know, did have, they did relate to sort of people's mental well-being. So you might actually kind of just move on to that issue, I suppose, now. So yeah, I mean, with that issue, mental well-being, how is it being managed in a community that's so diverse? I mean, I think, was it Jim that said earlier, I mean, 120 different languages being spoken. So with all the sort of like cultural implications and religious implications and language barriers. Kate, can I maybe ask you to speak on that?
Well, actually, the last data, there's actually 200 languages being spoken in our schools in Hertfordshire. Wow. So you know, we're talking huge amount of comms. But I was going to actually ask my two colleagues with Enoch and Harjit to first comment on it. Then I would like to do an overview after.
Super. Yeah, Enoch, maybe if you would like to speak on that issue.
It's one of the biggest challenges what we are facing during this time. I think, to me, different communities have different challenges. Also, with some communities, there are language barriers and trust issues to overcome. And particularly with some communities, they are reluctant to come forward as they have difficulty to disclose their issues. And we find this more and more in our communities. So One Vision has done a number of case studies during the lockdown throughout the communities. And we created a community ambassadors, actually, throughout the Watford. And they give feedback, they've done case studies. So now the One Vision is working with different communities, and we are actually landing a live platform, a mental health and well-being platform, which is going to be launched very soon by the leader of Councillor Robbie Martins from Watford. This will help. We identify about 18 different communities in Watford, particularly. They speak 18 different languages, actually. The 18 communities come forward with leaders, which we are in terms of training them to speak to this community in their own languages, and to understand their culture and their difficulties, so they can provide that support to overcome any impact they have with mental health or anything. It's better understanding with the same culture. They probably know what exactly is happening. I come from a Asian background, and I always seen people on giving, not taking. So when we are in a place, we are in a situation where some reason something went wrong in our journey, and we are reluctant to go and ask for help, ask for support. Not got to do with anything, with financial difficulties, even health difficulties. They feel, even when the COVID attacked, and they feel unhappy to disclose they got COVID, unhappy to disclose an approach to their communities because they're embarrassed. That's so. If we all come together, and we can really overcome this kind of issues what they're facing.
Thank you. Hajid, would you like to speak on that issue as well?
But it's quite poignant as well, because tomorrow is going to be International World Health Day as well. And, understanding sort of 5 warning signs of mental illness, one of them has been social withdrawal. And so we've been asked, and, we're going through the second wave as well. And, people not actually mingling with people. Within that, there's going to be issues that are going to arise, that we have to address, we have to look at. And I think, faith groups, communities are trying to find ways and means, but we need that human interaction with people, and we can't forget that. And with the projects up and down sort of Hertfordshire that are running, I think we're trying to actually still connect with our communities, trying to assist with them at the hubs that have been set up, supporting those hubs as well with food and supplies. So I think we have to realise that there's lots of other issues that are going to come up from COVID-19, people losing their jobs. At the end of the day, who doesn't want to support their family? Who doesn't want to support their parents? And so it's particularly, the human sort of side to it. It's been, something that's we all have seen, experienced, that, we need to reach out somewhere or another. I know modern technology is there, but we still need that human integration. And, like Reynold was sort of saying as well, that, even going to the places of worship where people meet up, where you can sing, that's been hard. I know they've tried to overcome it, and we've had our annual event called Celebrations in Watford. And this year it wasn't going to take place, but luckily we used the Zoom platform. And so we had different communities over a 3-day period where we actually, celebrated our communities, our culture, all different aspects to it. So, more emphasis that I would say that the human sort of tragedy to this, is taking place. And I've spoken to people where, where we've got a colleague, Liz, and she was talking that there's almost, 3 suicide attempts that she knows every day taking place. Those kind of things do sort of, weigh on us as well, doesn't it, really?
Well, we are. I mean, as human beings, we're innately social creatures.
Right.
So when that's sort of taken away from us, it's, it kind of goes against our nature. Kate, did you want to come in on that?
Yes, just to, thank you, Enoch and Harjit. Just to say, mental health is disproportionate to our community. So we would love you, Jim, and adult care services to keep it on the agenda at the higher level of conversations that you have. Locally, regionally, and nationally, of course, it would be a great help. But people have lost confidence in the mainstream. They have mistrust as well of services. And with the George Floyd and Black Matters, it brings up what I'm going to say is trauma amongst our younger people, our older people. And then because the younger people and older people don't actually access their GPs, their health services, so they've been hoarding it, hanging on to it, and have no release. You know, African Caribbean are disproportionately high within the criminal justice system. And when they have mental health issues, that's not going to be addressed, or we don't know anything about it. So really, really hard. And when young people face racism, families, etc., again, they've got nowhere else to talk because our mainstream are not geared up to have those sort of conversations with them. And that is, you know, key. And that's a message that's coming through, not only to myself, but to my fellow trustees, etc. And if we are accessing services, you know, there are a phenomenal group of BME-led mental health therapies, talking therapies. So can we acknowledge them and actually bring them to the table? They know their communities, they know their people, and some of them have actually lived through that as well. So let's include them and not just stick to the normal, what I call mainstream. That's the voluntary sector as well as the statutory sector. Thank you.
Yeah, thank you, Kate. I think that question of engagement is a really important one. So I might actually direct a question. This is probably suited towards Linda now. But what sort of strategies do you have for reaching people from BAME communities to ensure that they have heard about and sort of understood, I suppose, updates on you know, movement and mixing people relating to, you know, protecting themselves from the pandemic, but I suppose, you know, kind of building on what Kate was just talking about there. In terms of like services and sort of, you know, resources that are out there for them. What sort of strategies are being employed in Hertfordshire?
Well, we are working with district leaders across the whole area. So I work very closely with Peter Taylor, for example, from Watford. And we are all very aware of what we need to do in our communities. Obviously, films are being produced in many of the languages that are being, that are first languages across the area, and a lot of the social media again is being put out in other languages as well as English. So I think in a way what I would welcome from this webinar is more involvement with what you need us to give you. I mean, the community reassurance cell, we don't have any money. We're there basically to find out what the problems are, see if we can find solutions or offer ideas. And out of the CRC group we're working with Jim on providing safety equipment and training and education for taxi drivers. So I think that's, sometimes these might be quite small steps, but if we're able to work with one very vulnerable group of individuals, and then that's what we do. And because this is going to be the long haul, problems are going to be changing over the next 12 months. So I think we just all have to, as everyone has said, we all have a responsibility here for our fellow man, and we just have to all get on with it and make sure that we work within our communities. But we have to know what the problems are. Tell us. If we don't know what they are, there's not a lot we can do about it. So please talk to us either through your own community leaders or through Jim or through me.
So I suppose what you're saying is that it has to be a sort of, you want to be led by the communities, it has to be a sort of bottom-up flow of information.
Yeah.
I suppose, Clive, I mean, would you have a comment to make on that then, you know, as a sort of like leader with your community?
Yes, I do. What COVID has done is certainly brought home to us the level of inequalities that exist in our society and in our community. It's also made us realize that actually we've got to stand up as far as we can to ensure that those who are in a position to make a difference do what they can. So what we do know at the moment is that in the charitable sector where we are at as an organization, as Kate has said, resources very scarce. We are conscious that even local authorities are struggling with the resources. And it comes back to the point that I made earlier on, that I think we have to look at how we work together. So one of the things that we've done is approach both of the county that they're doing to address the issues that they are around. But actually, more locally, what we've been seeking to do is to reach out to our wider communities to try and engage them in the effort to begin to make a difference. So I mentioned earlier on that one of the things we did was to set up a WhatsApp group to actually enable people to communicate together. We also have some of our members who ring people up to see how people are doing, because actually the isolation, the loneliness that we're experiencing is something that actually we've never experienced in our lifetime, and we still don't know the mental health impact that this is going to have, particularly amongst our younger people. So I think there's work that we're all going to have to do over the long term, and we will do whatever we can within the limited resources that we have available to us.
So there's a question relating to this issue as well, and just sort of picking up on things like the WhatsApp group. I mean, what's the take-up for that WhatsApp group been among sort of older people who might be, I suppose, less kind of comfortable and familiar with technology?
Well, the take-up amongst older people, I'd say, is not great, but that's one of the reasons why we also use the telephone, because actually a lot of people still use that mechanism. But I think we, unfortunately, because of a need to social distance, we have to just use those facilities that we have available, because clearly there's a lot of fear in our community, and that's not going to disappear very, very quickly. In fact, one of my worry is that it might take longer than you might otherwise expect to ever go back to what we might call a new normal.
Yeah, okay. Thank you very much. So I'm going to move on to another question here. This one's probably for Jim, I would say. So Jim, has our current knowledge of the risk factors associated with disproportionate mortality of BAME people due to COVID got any better compared to the situation in early days of COVID-19? And what actions have been taken from the lessons learned? What measures have been put in place for our BAME communities to face the second wave?
So I think the short answer is we do know more. We know more about the fact that our BAME communities are not just biologically more susceptible. It's actually about things in the workplace, things in public transport, and a variety of other things. And that has enabled every agency to put in place a risk assessment to protect staff. So if you look at social care, for example, if you BAME workers in social care, making sure that they've got the right PPE, and we all know the problems that happened with PPE nationally in the early days. So that's the first thing. So those actions should have been taken by every employer in health and social care particularly. I think the second thing is we know more about the prevalence in our BAME populations of vulnerability factors like diabetes and so on. And I've been pushing for GPs and other health services to make sure that we target people who are at higher risk to make them as healthy as possible to resist the virus as much as possible. I think we also know that physical activity and giving up smoking are two things people can do, and improve diet. So we've had a significant level of uptake of our stop smoking services. 600 people alone for the first peak of COVID, on top of our existing services, gave up smoking for COVID. Now, those are things that are being done. I think there's a lot more that needs to be done. And I think every organisation needs to do more. So, and that also includes the mental health of staff. So I don't know about anybody else, but, I vaguely remember a time when I wasn't working 12-hour days. And I vaguely remember what a weekend is called. But it's kind of gone like that. And you have to find a way of caring for yourself. And one of the things about if you do this job because of your values, or you do something like, but work as a carer or a nurse because of your values, you have to find a way of self-caring. And there are cultural issues about self-care in many different BAME communities that white managers don't understand. And that may mean we tend to assume BAME staff are better when they're not better. And so we need to get better at working with our colleagues and understanding their limits as well. I think there's some work going on that, but we need to do a lot more. We have done a lot of mental health, so we've commissioned specifically for care workers in care homes programs to train people up on stress and trauma. But there is much more we could do, if that makes sense. That's probably just scratching the surface, and you could probably have a separate webinar just on what are we doing, what more do we need to do, and a separate webinar on how do we co-commission the research. So those are still, for me, things that we are just starting on, but need to do more of.
Yeah, no, I think you're completely right. I mean, there's so many different, and that really came out in your presentation. I think there was so many different threads, that almost we could have a conversation just about that, rather than trying to do it all today. So I think, yeah, there are more conversations to be had, definitely. I think at this point now, we're getting some really good questions into the Q&A. So I might start addressing some of the questions we've got this evening. So again, if you want to keep putting those questions in there, you can vote for the questions as well, so you can sort of pick the most popular ones. There's one here I want to address. What can employers, particularly large companies in Hertfordshire, do to support the efforts here? Kate, that might be a good question for you, I think.
Oh, right. A lot. They can do a lot. First, have they actually know their own workforce? Mm. Are they familiar about the different cultures their workforce come from? We all do sometimes just assume, oh, well, they speak English very well, so they must be all right. Do you know what I mean? So internally, first talk to all the staff, find out. As I understand, at the Hearts Forward, David Williams said at the conference that they talked to all their staff at County Council and discovered a whole raft of information that he personally was unfamiliar with. And I think that happens with all our statutory. So look internally, get talking with your own staff, and then reach out. Hopefully we will have a better communications channel now and reach out to BME-led services. There's so many around who've got these therapies. They're all professional. Just because we're in the voluntary sector, don't assume that we're not professional, well qualified, well skilled, and experienced. And it's all this thing about lived experience. So I just say, look internally first, and then reach out via the channels.
Thank you. I don't think anybody listening to any of our speakers this evening is thinking, oh, voluntary sector, they don't know what they're talking about. I think it's rather the opposite. Most
really?
So yeah, there's no fear of that. Thank you so much. Does anybody else want to come in on that one?
Yes, I'd like to come in on that,
yeah,
please.
Right.
I think I'd say I agree with Kate, but what I would say is that the issues that we've got is a result, have largely resulted from a long period of inequality that has existed in our society. Now, no single one of us as an organization will resolve this. But actually, if every large organization starts looking internally at itself and thinking about what are we going to do as an organization to move this agenda from where it has been. Mm-hmm. The Race Relations Act was way back in 1976, and you'd think that by now we shouldn't be having these conversations about the impact of inequalities. So I would say large organizations need to look internally at themselves and look at what are they going to do to begin to start making the change. it's going to be together that we're going to make this difference. And every organization has this role to play. So start looking at what you're going to do to make a difference. And if we all do that, we could make a change very quickly.
Yeah, I think it's a really powerful message, isn't it? Thank you, Clive. So I come to a question here from Malcolm Sellen. Is there any research on protecting elderly people or vulnerable adults from the BAME community in care homes and hospital settings? And I think there was sort of a piece in the chat as well, talking about those people feeling, people in care homes feeling particularly isolated when they're sort of cut off from their families. Does anybody want to pick up on that question?
The short answer is we have developed a policy to try and ensure that people who need visits in care homes can get them. Mm-hmm. The difficulty is it's a balancing act of protecting the people from infection and enabling people to visit. So we've got two things we're doing. The first is we've put a specific policy in to help care homes allow visitors in where that can be done safely. We've actually changed our arrangements to allow more visitors in. And the second thing is we are trying to find a way of designating a carer for every person as a key carer, so that that person is treated a bit like a worker, so they can have access to regular testing and PPE. The problem is the national testing system, and please don't get me started on that. But we are working with Care England on that and trying to do that, and trying to find a way of balancing it is a short answer. We lost several hundred people in care homes over the course of wave one, and thousands across the UK. So there are no easy answers, but if people have ideas and suggestions, I'll happily listen.
Thank you, Jim. I do have a question here from Bethan again, which I think is quite an interesting one. What work is being done to ensure that non-BAME residents in Herts are educated on the impacts of COVID on BAME residents? I think that's a really interesting question. I mean, Linda, do you maybe want to pick up on that one first?
Yes, no, it is an interesting question. And there is a coordinated communication programme through County Council, organised in coordination with the Public Health Department. And I think that is something that perhaps we can take back to make sure that it's communication is not just aimed at the BAME community, but actually is also aimed at everybody, but an understanding of just some of those differences. And I think I was on that call with David Williams on Hertfordshire Forward, and I think that I was just struck by what he said. And I think perhaps all of us need to get out there and actually get ourselves into an organisation where we may feel uncomfortable, if we're honest. And that covers that, that's available for all of us. So put yourselves, invite me to something. Let me come and see what you're doing, because I really want to see it on the ground. I know I can't hug anyone, I'm not allowed to, but I think again, it is that recognition of what we all have in common and what those differences are that make Hertfordshire actually a really great place.
Thank you. Does anybody else have any comments on that one?
Yeah, I've also got a comment on that, only because it gives me a chance to advertise something too. This month, of course, is Black History Month, and one of the things that we're doing next Thursday is to have a debate and a conversation around Black Lives Matter and white privilege. And we're particularly wanting to engage with our white colleagues to look at that issue and look at what is that all about, what's the impact, so that we can all look at how we're going to learn and grow together and create a different kind of society with that sort of common understanding of the issues and the concerns and the solutions potentially that there is to them. So that's next Thursday. If people are interested, then they can drop me a note and we will invite you to the Zoom.
Well, I mean, we can certainly help out there. I mean, we can put a link into the follow-up email for this session. So yeah, I think we're going to have quite a few resources to put into that email. So I'm looking forward to putting it together. Yes, we might go back to the Q&A and we'll see what else we have here. So yeah, if you guys, if audience members, if you keep those questions coming in and do keep voting for them, because I'm trying to address the ones that have the most thumbs up. There's a question here specifically about students. Has the increased risk of COVID in BAME students with health risk been shared with secondary schools in Hertfordshire? And what is being done to protect these students?
So every single school in Hertfordshire has been required to produce a risk assessment. Every child with underlying health conditions has been required to be risk assessed. We have an infection control team of public health, environmental health, infection control nurses, and health and safety people, as well as 2 experienced head teachers who are doing nothing other than working with schools. So we are, in fact, we're actually trying to reduce the numbers of size of children in bubbles at schools to keep them healthy and safe. And we're also working on catch-up campaigns for children who've missed their vaccination. And we know that BAME children are sometimes not great at getting vaccinated. So those are the things we're doing now. I think the issue will be, we don't think BAME children, just because of BAME, are at more risk of COVID than white children in the school environment. It's whether either they've got underlying health conditions or their parents or families are more exposed because of the jobs that they're doing. It's that kind of thing. It's not a biological thing. So we are working on it. I think my advice would be, if you think there's more we can do, speak to your school head teacher and ask them to contact the school's COVID team. And that team meets every single day to discuss all the school outbreaks in the county and work on it.
Thank you. So I have a question myself, actually. It's probably for Linda, but I don't know, maybe it's needless to point it out, but a virus doesn't sort of respect borders, you know? So I'm just wondering, what is Hertfordshire doing in terms of like collaborating with other councils and stuff to sort of counter the virus?
Thank you, Finn. I think Jim obviously has got an extraordinary network across the country. And if I'm honest, we make sure that we work with Jim so that we can work with everybody else. We do have very good relationships with our neighbours around the area. We do need to make sure that we have regular conversations with areas such as North London, Barnet, Enfield, and out to Luton, because, as you say, and also Hertfordshire has, even though a lot of people are working from home, has significant dynamics of people moving in and out of the county to work. Mm-hmm. So if there are spikes of infection going up in certain areas, it may not be because it's due to a single cause. It could well be because we have individuals moving in and out of London, and that's how it's happened. So I think, you know, we do our best to make sure that we are on the button with what's going on elsewhere, and we work with councillors, community groups, and with Jim as a pivot.
Thank you. So there's a question
Sorry,
here.
Finn. Sorry,
Yeah.
It's Kate. I just also want to add, you know, as we sit and talk about this, there's so many reports now available. I know certainly my colleagues, my fellow trustees on the Herts Equality Council are in possession of different reports. So we would certainly like to put that in the pile of discussion with you, Jim et al. Thank you.
No, thank you. There's a question that's sort of shooting up the Q&A. It's getting lots of thumbs up. Are any panelists hopeful that the Race and Health Observatory will provide a clearer strategy for narrowing health inequalities in the future? I'm not sure who would like to pick up on that one.
Being the resident geek, shall I pick up on it? Health observatories are, sometimes some people think they're a bit old-fashioned because we had an obesity observatory, a learning disabilities observatory, and an end-of-life observatory. And the things those observatories have achieved will be to focus absolutely on learning as much as we possibly can, and kind of being a bit like a searchlight of going round and looking at stuff. And I think we're learning much more, I think, that different issues for different populations and for all of our diversity characteristics are really important. So I think the Race and Health Observatory is long overdue in coming. It needs to get out there. I think it needs to spread the expertise in data analysts across the profession. If it's anything like as good as the Learning Disabilities Observatory, will make a significant impact. So we desperately need it, but we also desperately need to kind of, it's a precious resource and we must argue for it to be well funded by government, I think, in terms of its money coming from the National Health Research Infrastructure. But BAME communities in public health research are still under-researched.
Yeah, thank you. So I'm just sort of conscious that we're kind of coming towards the end of this session. So I suppose it just might be kind of an important question. What does this network, what do we hope to achieve in sort of, you know, the next 6 months, the next 12 months, the next, you know, moving into the future in terms of like tackling those health inequalities? It's sort of an open question, really. Who would like to come in on that one?
I think if I can make a point here, I just want to say well done to the equalities team as well, to setting this network up, because just as Linda said, Kate said, we need a conversation and you need to start communicating with communities. And once we have those ideas, feeding those through, you know, I think it's just a start, like Jim was saying as well. We've got to talk about the long haul. There's lots of other issues that will come in the future as well. And we need to make sure that we're actually linking in with the BAME community, having that conversation, and whatever issue is going to be in front of us, I think communication is the key to getting things done. Because I do want to point out, which I say many times, is there's communities within communities, and when we understand that, then we'll start, you know, going through those issues, and hopefully we'll be a bit more enlightened on how we can actually bring together a solution. And the solution is to working together.
And just to add to that, Harjit, sorry, Finn.
No.
And it has to be continuous. It can't be just one, oh, well, we've dealt with that community now, next. You know, you have to go back and go back and go back in order to have the feedback and make sure that we develop this trust now, which is critical at this point, that something will be done. There will be some changes, you know, whether it's structural changes, but we need to then go back to the communities and go, actually, we've moved this way, but we want that one. So it's just a continuum, and that has to carry on from today. Thank you.
It's a call to action, isn't it? So what
Absolutely.
I might do at this point, I might pass back to Linda as the chair. If you would just sort of like to kind of be like a closing remark, I suppose, before I things up.
Okay. Well, first of all, thank you to all of you for being very erudite panelists. Thank you again to the Lord Lieutenant for being with us. We much appreciate your time, sir. I think I'd just like to finish on one comment. When I was asked if I would start up and chair this community reassurance cell, I have to say it took me quite a while to work out what it was going to do. Because community reassurance cell doesn't really flow off the tongue very easily, and it's not, apart from 3 words which all mean different things to different people, it doesn't actually mean a great deal. So whenever I do this, I always say, please give me a proper name, because I think I could really do with one. Anyway, so I think the CRC now knows what it's doing. Well, that's a very big word, but it knows where it's got to go. And I think this webinar tonight just totally demonstrates the importance of together we will have the resilience and the resource to actually find solutions to some of these issues. If we all just carry on sitting in our own little square on the television, we won't get there. But actually, by working much more closely together and being honest with each other and learning to trust each other, then we can get somewhere. And yeah, safety of taxi drivers was a very small step, but it's important for the drivers. And it's also really important that when you put your frail mother in the back of a taxi, you know that she will be safe because the taxi driver has been well trained and understands what the issues are when he's driving her. So I think we have to do little small steps, and then suddenly we'll start be able to say, hey, in a year's time, just look what we've actually done and what we've actually achieved. So I welcome any comments from any of you. Google me, I'm on the East Herts website. I've got my email, it's all up there. And thank you all for being here. Thank you, Finn.
Well, I think what we can offer to do as well, Linda, on that, I mean, it has been so heartening, I think, just looking at the chat all evening and seeing people posting links and sort of sharing information and sort of reaching out to help one another. So, I mean, just to say it to all the audience, you know, we can certainly put together, we'll go through the chat, sort of put all those resources together into an email, and we can send that out next week, just so you have that all collected into one place. I do, before we finish up, I mean, we've had the Lord Lieutenant in the audience today, and I believe he wants to say a few words. So I'm actually just going to promote him to the panel right now.
I'm not sure if I can be heard. I hope I can.
We can hear you.
Fine, and I'm not sure if I can be seen, and hopefully not if you're all lucky. I just want to thank the panelists and thank you for your invitation. This has been an absolutely fascinating hour and a half as far as I'm concerned. Let me just see. I'm now told my video is started, so hopefully you can see me, I'm not sure. So this has been an absolutely fascinating hour and a half. And I want to thank, as I say, all the panelists. I think I know you all. It's interesting and I think important that there are representatives not from the BAME community involved in these discussions. I think that is a very important issue. And Kate Berlinis will have very modestly not included in her many, many roles the fact that she is a deputy lieutenant, and I can tell you has brought this issue very much to the lieutenancy, and it is something we are discussing on a very regular basis. There's no question we live in unprecedented times, and I think the impact of this terrible pandemic is really only just being felt and will be felt for the next 12 months, if not longer, sadly. And there's huge frustration around the county generally and the world, I would say. But there's no question in Hertfordshire, and I think this has come off very clearly tonight, we are a very diverse population, diverse in all aspects. Even when we look at our university, which has 51% of students from a BAME background, it really expresses the diversity of the county. We're also a very community-minded county. We have in excess of 250,000 people in this county who are regular volunteers, and I mean regular volunteers, which is quite exceptional. Hertfordshire is often thought as a county of leafy lanes and big country houses, but of course there are many areas of great deprivation, two of which are amongst the most deprived in the entire UK. People say that this pandemic does not discriminate. Well, I think I've heard slightly differently today, but we've all had tragedy. I've lost 2 friends. I've even lost a 42-year-old cousin. So it doesn't discriminate, and it is here, unfortunately, to stay. Jim mentioned the idea of COVID champions. I think that's an excellent idea within different communities, all sorts of communities. And I think one thing that we have to be very aware of is to keep young people engaged. I think that is a key issue for all of us in all our communities. The future, I think, is unknown. We're all at risk. I assume we all believe that this is going to be here for a considerable length of time, but I'm seeing the faces here and others in the audience who are the leaders in their communities. And I think it is very important to realize that at this difficult time, we as leaders of our communities, as leaders in the county, as leaders in the country, have a very significant role to play. And I'm delighted that this discussion has taken place and has proved to me that everybody is coming up to the plate and really taking on board those leadership roles, which I think is very important in all communities. So once again, many, many thanks for this invitation to what has been an absolutely fascinating discussion. Many thanks.
Thank you very much, Lord Lieutenant. So I suppose it just falls to me now to sort of finish up proceedings. I do see that people are asking for the videos, so there will be a recording, and as I say, we'll go through the chat and sort of compile all the resources and put them into an email that can go out next week. But I suppose just to finish up, I mean, really to echo what the Lord Lieutenant was saying, I mean, you know, I think it's sort of testament to how much people care that we would all be here, you know, Friday evening, you know, sort of sharing resources, sharing information, sharing knowledge. I feel like I've taken something really positive from this, and I hope everybody who's tuning in has too. So look, I suppose with that, I think we can call an end to the session. From myself and all of our speakers today, I hope you all have a good and a safe weekend. Thank you very much.